Every morning, millions of us wake up and immediately start trying to hack our biology. We chug enormous bottles of water, blend up expensive detox powders, and force down an unwanted meal, all in the name of wellness. If you skip that morning meal, you might feel guilty. You've been told your whole life that eating early jumpstarts your metabolism. The truth is, your body burns calories continuously, no matter when you eat. And that daily guilt trip is the result of a century-old marketing campaign to start their day with his new invention, cornflakes. So his company funded nutritionists and newspaper columns to repeat one catchy, highly profitable line over and over until it became accepted health doctrine. We see this same echo chamber with hydration. The unbreakable rule to drink 8 glasses of water a day stems from a 1945 U.S. Food and Nutrition Board report. The public simply missed the very next sentence, which noted that most of the water we need already comes from the food we eat. Then there is the commercial detox industry, selling teas and cleanses to flush out toxins. You already have a highly advanced detox system built right in. They're called your liver and your kidneys, and no expensive juice powder can outdo the filtration work they've been doing quietly since you were born. The wellness market also loves to promise an immune system boost. But dialing up your immune system to maximum power is actually dangerous. An overactive immune response that mistakenly attacks healthy cells instead of threats is the literal definition of an autoimmune disease. Your body requires balance, not a boost. We spend immense amounts of time and money worrying about these fabricated risks. Meanwhile, this endless stream of health marketing distracts us from the data showing what actually threatens our longevity. To understand what is actually threatening the health of 330 million Americans, we have to look past the wellness aisle and examine the raw demographic data of national mortality. For Americans between the ages of 1 and 44, the leading cause of death is preventable accidents. And right now, nearly half of all those accidental deaths are poisonings, driven overwhelmingly by drug overdoses. This chart shows the exponential spike in deaths caused by one specific substance, fentanyl. Overdoses from fentanyl grew from just over 3,000 in 2010 to a staggering 74,000 deaths in 2022. This demographic breakdown shows what happens at age 45. The math shifts. Preventable accidents drop down the list, and cancer overtakes them as the dominant threat to American lives, maintaining that top spot through age 84. Looking at the far right of the graph, for individuals surpassing age 85, the primary risk changes one last time. Heart disease becomes the overwhelming cause of mortality, responsible for over 250,000 deaths in that bracket alone. Decades of family dinners have featured warnings that cracking your knuckles causes arthritis, a claim repeatedly proven false by medical studies, showing it's just gas bubbles popping in joint fluid. But those same conversations often ignore the actual, statistically verified risk factors destroying our health. Obesity, medically defined as having a body mass index of 30 or higher, is a massive driver for both cancer and heart disease. Between 1995 and today, the obesity rate among American adults more than doubled, climbing from 15.8% to over 33%. The true crisis isn't a deficiency of superfoods or the lack of a complex morning routine. We are a rapidly aging population facing deep systemic challenges, from widespread overdoses to skyrocketing obesity rates. Managing those macro-level realities requires a massive, labor-intensive physical infrastructure. Keeping this population alive requires a system that accounts for over 17% of America's gross domestic product, a staggering $4.5 trillion a year. This pie chart illustrates exactly who pays that bill. The single largest contributor isn't private insurance companies, it's the federal government, picking up 33% of the total cost. This same chart shows the immense financial weight placed directly on households. Through out-of-pocket expenses and insurance premiums, American families cover 28% of the total, pouring $1.2 trillion into the healthcare machine out of their own bank accounts. We frequently hear that high prescription drug prices are the primary culprit for these massive costs, yet the data reveals that prescription drugs account for just 11% of national healthcare spending. The actual financial drain lies in the facilities themselves. Routine care, emergency rooms, and surgical centers add up quickly. Hospitals consume an enormous The monetization of American health operates entirely outside the flashy consumer wellness market. It is a highly subsidized, heavily bureaucratic macroeconomic engine. Human biology and national healthcare economics are dense, intricate systems. You cannot solve an aging population's health crisis with a detox tea, and you cannot fix a multi-trillion-dollar expenditure with a catchy political slogan. Real health maintenance is remarkably unglamorous. It rarely makes for good marketing. It relies on extremely boring routine habits like getting 8 hours of sleep, eating a balanced diet, and practicing basic hygiene. We balance those incredibly simple personal habits against a daunting societal ledger. The average amount spent on healthcare in the United States has ballooned to over $11,000 per person every single year. To navigate this reality, we have to permanently mute the constant noise of the wellness industry. We need to focus our attention on the real demographic shifts and the hard financial numbers that actually dictate the length and quality of our lives. Stripping away the marketing myths leaves us with the unvarnished facts of American biology and economics. And understanding those facts is the only reliable way to become effective patients for ourselves and informed voters for our country.